If your tape player has a real time counter, set the counter to 0 at the sound of the third beep, which comes at the end of this countdown. The skull consists of the cranium and the facial skeleton. The cranium is the bony container for the brain and the foundation for the facial skeleton. The cranium is made up of a number of originally separate bones. These lines of fusion, known as sutures, show where the bones are joined. The principal bones that form the cranium are the occipital bone behind and below, the parietal bone and temporal bone on each side, the sphenoid bone and the frontal bone. The two bones of the cranium that we're concerned with at present are the occipital bone and the lower part of the adjoining temporal bone. To see the full extent of the occipital bone, we'll take the mandible out of the picture. The occipital bone extends all the way from here at the back to here underneath. The most striking feature of the occipital bone is this large opening, the foramen magnum, through which the spinal cord and its accompanying structures pass. The part of the occipital bone in front of the foramen magnum is called the nasal part, often referred to as the base of the occiput. The two temporal bones converge on it from each side. We'll look at them in a minute. Let's look at the occipital bone on the inside in a skull that's been divided in the midline. Here's the foramen magnum. Here's the basilar part of the occipital bone. It slopes forwards and upwards, more steeply on the inside than on the outer side, since it's perpendicular in sagittal section. Let's look at some more details in a skull that hasn't been colored. On each side of the anterior half of the foramen magnum are the two occipital condyles. The occipital condyles are the joint surfaces which articulate with the atlas vertebra to form the atlanto-occipital joints. We'll look at these joints in a minute. The outline of the front and the top of the cranium is well known to us from our everyday observation of surface anatomy. It's perhaps surprising to see how far round the back of the cranium curves, and what an extensive overhang there is behind. The overhang is formed by the part of the occipital bone that's behind the foramen magnum, the squamous part. The overhang is obscured by the neck muscles that are attached to this broad area on the occipital bone. The bone bears the marks of their attachment. This lump in the middle is the external occipital protuberance. This faint ridge, leading out toward the mastoid process, is the superior nuchal line. Below it is the inferior nuchal line. We'll meet the structures that are attached here later in this section. Now that we've looked at the occipital bone, let's take a look at the temporal bone. It's quite a complicated bone. To see its full extent, we'll again remove the mandible. The temporal bone goes from here on the outside to here underneath. This is the petrous part of the temporal bone. This is the squamous part. A prominent feature of the temporal bone is this large projection, the mastoid process. As we'll see, it's the origin of some of the muscles that move the head, including the sternocleidomastoid. It's easy to feel the mastoid process here, behind and below the ear. While we're getting introduced to the temporal bone, we'll take a first look at some of its other important features, which we'll appreciate in later sections of these two tapes. We'll also meet some of the small openings through which important blood vessels, nerves, and other structures enter into the brain. There are many of these openings. Here, we'll just look at openings outside of the temporal and occipital chambers. This is the zygomatic arch, formed largely above the temporal bone and partly on the adjoining zygomatic bone. Here, underside of the root of the zygomatic arch. This complex curved surface articulates with the condyle of the mandible to form the temporomandibular jaw. This is the external auditory meatus leading to the middle ear. This long, sharp projection is the styloid process. Just at the base of the styloid is the little stylomastoid foramen for the facial nerve. Medial to the styloid process are two major openings for blood vessels. The carotid canal passing forwards begins over the artery, and the jugular foramen passing backwards for the internal jugular vein.
Fear.
Just above the occipital condyle is the hypoglossal canal for the hypoglossal nerve. Let's take a brief look at the occipital and temporal bones from the inside. Here's the squamous part of the occipital bone. Here's the basic foramen. Here's the foramen leg. Here's the squamous part of the temporal bone. Here's the petrous part, which contains the structures of the inner and middle ear. Here's the jugular foramen on the inside. This big groove behind it is for the sigmoid sinus, the main venous drainage channel for the brain. Below and medial to the jugular foramen is the hypoglossal canal. Above the jugular foramen is the internal auditory meatus for the vestibular, cochlear, and facial nerves. The carotid canal ends here at the foramen lacerum, as we'll see in the next section. Now we've looked at the part of the skull that we're concerned with in this section. We'll move on now to look at the bones below it. First, we'll look at the special features of the first two cervical vertebrae, atlas and axis. Then we'll look at the continuity of the cervical spine with the bones of the upper part of the trunk. Here's the atlas. Here's the axis. These two vertebrae are adapted to allow movement of the head. Forward flexion and extension of the head take place up here at the atlanto-occipital joints. Lateral flexion of the head takes place at these joints too. Rotation of the head, together with the atlas, happens here at the joints between the atlas and the axis, the atlanto-axial joints. Because of their special functions, the atlas and the axis differ in several ways from typical cervical vertebrae. As we've seen in Part 3, a typical cervical vertebra has a body in front and a broad arch behind, enclosing the vertebral bone. It has a sinus passage behind, with two tuberosities. The transverse process on each side has two tuberosities. On each side there are two articular surfaces, one above and one down below, which form the tubercle bone. The articular surfaces then upward and forward. Their angle passes down the bone, the orbital bone, which therefore determines the challenge of the and part 2 Thank you. hadron-like masses. As rotation occurs between these solar